continue to gradually improve over time. However, our healthcare system is still struggling. We still have a ways to go in that regard. We have too many people in hospital right now that are requiring care. Too many people in ICUs, both in Manitoba and in other provinces. But like always, Manitobans have always had the ability to change this. And as we see from our numbers, Manitobans have been working hard to address this. So by staying home as much as possible, we've been able to start breaking some transmission chains and start seeing some of these numbers coming down. By getting vaccinated, Manitobans are making a difference, decreasing the risk for themselves, the people around them, and all Manitobans. Everyone over age 12 is eligible for vaccine, and if you received your first vaccine before May 1, then you're now eligible to book for your second vaccine, so I'd encourage all Manitobans to do so. It's up to us to take these steps to, again, protect ourselves and protect our family, protect our loved ones, and protect all the Manitobans. By taking this action and changing our behaviors, getting vaccinated, we've been able to start to see the downward trend in our numbers, start looking forward to what things can be like in the future here in a vaccinated Manitoba. So to bring an end to this and start getting our lives back to normal, we need to get vaccinated. We need to practice the fundamentals. We need to follow the public health orders as much as possible. So a reminder that the heat-related public health order changes are still in effect. But please note that these services were made to be available for those who don't have readily available escape from the heat. So if you have air conditioning, a pool, or a sprinkler at home, or an ability to escape the heat, please do so, but refrain from using these public available services that we've made to those who don't have access for that escape from the heat. So let's try to keep those services available for those who need them. Restrictions on gatherings and interactions with people who do not reside at the same private residence continue to apply even at those locations. So thanks again to all Manitobans, and I can take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CTV Winnipeg, Jeff.
Hi, Dr. Roussin. Just seeing what Nunavut has announced that they're going to lift quarantine rules for people who are doubly vaccinated. And that is something that's mentioned on the latest survey Manitoba's put. How seriously is the province considering, lifting travel restrictions for people who are fully vaccinated?
Yeah, and so we're taking those type of things very much under consideration right now. We know that vaccine is our way out of this, but we need to be fully vaccinated to really see that benefit. And we're looking for ways to make being fully vaccinated count. So we don't have anything specific. There's going to be more later this week that we can discuss on that. But those are the type of things that certainly have been considered.
And obviously, you touched on it, that case counts, the number's down, it's trending down, you say, but our hospitalizations are obviously still an issue, and the test positivity rates are still high. What would you have to see in a test positivity rate to really, lift restrictions in a meaningful way?
So we absolutely need to see a clear downward trend. And so we're at the early stages of that. We see decreasing numbers, but that also corresponds to some days with lower test volume. So we need to see that real clear downward trend. Again, we don't look at just one indicator, so I can't say, we have to hit this specific level of test positivity, but absolutely we have to see that that's a clear downward trend. We have to see that the demand on the healthcare system is decreasing, so they can get back to providing that care to all Manitobans, whether they're COVID positive or not. So in addition to the test positivity, those are the type of things we need to consider as well.
From City News, Mike.
Well, good afternoon, Dr. Roussin. My first question is just your thoughts on the Canadian Premier League inviting all teams from across Canada to begin their soccer season in Winnipeg in June 26th. Can I just get your thoughts on that?
This plan was reviewed by public health, and because it occurs in a bubble, then it's really very low risk to Manitobans, and that's really what public health is concerned about is the health of Manitobans, and so this taking place within a bubble, taking place at a time when we're trying to show that there will be hope, that all pandemics end. That we will be in a post-pandemic Manitoba at some point, and still trying to show that with strict measures we can still allow something like this to occur with very little risk to Manitobans.
Yeah, thank you for that. My follow-up question, similar to what Jeff asked, seeing a decline in cases but when transmission chains, when do we expect to start seeing that downward trend visible in hospitals and ICUs?
Yeah, and so this is that lagging indicator, right? Because we see it lag both ways. When we see case numbers climbing, we're not going to see that increased demand on health care for that week or two following it. And then the same thing occurs with a downward trend. So in hospitalizations, we start seeing that probably about a week or two after declining numbers. ICU sometimes takes longer because sometimes we have those long stay clients in the ICU. So you could see that between our second and third wave, we had quite a stretch of many weeks there with fairly good numbers, but you could see that our ICU numbers still maintained a very high level between that because it's such a lagging indicator. So we need to ensure we're protecting that healthcare system.
From CHVN, Taylor.
Hi, good afternoon. Over the past week, we've seen people not as willing to follow the health orders, especially when they're outside. Is this something public health is concerned about?
I think that, we said this, even from the first wave, these restrictions are difficult. Now 15, 16 months into things, even more difficult for people. I think it's clear as to why we need to have restrictions like this when we see our ICU numbers, when we see the demands on the healthcare system. But we know it's getting challenging. But at that same time, we're starting to see some of these numbers come down. We're seeing vaccine uptake climbing. And so we need to keep those trends going and then show that we have some hope there. The outdoor gathering, of course, that is lower risk than indoors. And so I think that, we definitely encourage people to be outdoors for this last sort of circuit break. We really wanted people to maintain those close contact with households only. But we're hoping within a short period of time in the outdoor settings we can extend that slightly.
Thanks. And along those same lines, a lot of people are getting their vaccines now, even their second ones. When folks are outside, they are using those as more reasons to be less cautious about the health orders. If someone was thinking about doing things like going to the beach like we saw this weekend, what should they be thinking about when it comes to the pandemic?
Yeah, and so right now we really want to everyone following those fundamentals and following the public health orders as best they can. At the same time, we want everyone to get vaccinated. Remember, each person who takes a vaccine, and especially when they become fully vaccinated, is one less person who's likely to have a severe outcome from COVID, but it's also one less person who's very far less likely to be able to transmit COVID to others. So we get that significant benefit with each and every Manitoban that gets vaccinated. The important thing to remember is that after a vaccine, especially after that first dose, it takes weeks to build up that immunity. So we really want to discourage Manitobans from getting that, especially that first dose, and then getting that sense of invincibility that you can go, I don't need to follow the orders. We do see a lot of people in hospital who's, between that couple weeks of getting the vaccine and getting ill because they didn't yet develop the immunity. So right now that messaging is with or without vaccine, follow the fundamentals, follow the public health orders. As more and more Manitobans get vaccinated, we're going to be able to loosen those orders for everyone, and we may even start being able to target certain things for fully vaccinated people.
From the Winnipeg Free Press, Danielle.
Good afternoon, Dr. Roussin. In the past week, excluding household transmission, where did people catch COVID-19? And why haven't any workplaces been ordered to close yet? Are there no workplaces contributing to the case counts that we're seeing right now?
Yeah, and so we still, as you say, we see household transmission, we see social gatherings as defined as those where we see transmission. We see transmission, all along in certain workplaces, or at least related to workplaces. It's often difficult sometimes to know whether the transmission is necessarily occurring within the workplace, and so it just depends on the nature of that of the transmission, the nature of the workplace, and so we've been managing those clusters in workplaces, since wave one, and so it's not anything new to see transmission within workplaces, not anything new for public health to be managing those. As far as closing them down, and so this is going to be all related to what the public health investigation shows. If there's no way of controlling transmission, the active transmission within that workplace, then closing that business may be warranted. If there's a way of dealing with the transmission without having to close it entirely, then we're going to take that method. So it really depends on that public health investigation at the regional level, but certainly there's transmission or at least cases associated with workplaces.
Thank you for that. And with the exception of 3 Winnipeg health districts, vaccine coverage within the city is 70% or higher. How do you think this level of immunization is going to affect COVID spread in the short term, and how will it influence the next set of public health orders that you're working on?
Yeah, and so I think that we know that the higher the vaccine uptake, the better. We know both at the individual and at the population level. We have a lot of Manitobans requiring ICU care. We have very, very few vaccinated Manitobans requiring ICU care. And again, there might be a lot of reasons why people hadn't been vaccinated, but that's the fact is that we don't see our ICUs filling up with vaccinated Manitobans. They're filled with unvaccinated Manitobans. So the more Manitobans we get vaccinated, the less severe outcomes we're going to see. And when I say vaccinated, it's really fully vaccinated is really what we're shooting for. We need those second doses, but of course you can't get your second dose unless you get your first. So those vaccines really are going to overall hopefully decrease those transmission chains, but more importantly, it's going to decrease the severe outcomes related to COVID, which will decrease the strain on the healthcare system.
From Global News, Joe.
Afternoon, Dr. Roussin. You mentioned you're working on, the next set of restrictions and that, but can we expect anything at all to be relaxed when these? Can you hint at what these next set of restrictions could look like this week?
So what I would say is that given the demands on the healthcare system right now, we're not in a position to significantly loosen anything right now. So that's what I would say. We alluded to earlier that some of the we know the outdoor settings are less risky, so we can consider something like that about the outdoor settings. But again, it's given that we have our ICUs under significant strain, we can't expect this round to have any significant loosenings.
Thank you. And again, you mentioned about people who have received both doses of the vaccine. So does our long-term reopening plans involve a vaccine passport, and where is Manitoba at in developing something like a vaccine passport?
Yeah, so there's a couple of things. So, there is a sort of a vaccine, a digital vaccine card or identifier that's in the works. So Manitobans are going to have the availability to prove their vaccine status. How that's utilized within Manitoba, that's something yet to be determined. But we wanted to ensure Manitobans have that ability to prove their vaccine status, just because we can't control what other jurisdictions do. So we want to ensure Manitobans had that ability.
From the Brandon Sun, Kimberly.
Good afternoon, Dr. Roussin. Last week, the Union QP204 President Debbie Boissonneau released a statement saying that healthcare aides are being asked to perform nursing duties by the WRHA. And I'm just wondering why support staff is being asked to monitor patient blood pressure, blood sugars, medical creams, and other treatments when they are duties for nurses.
So, I can't comment on the specifics. We should probably just direct that to the RHA or Shared Health is best on that. I know that, overall we want to ensure that we're utilizing everyone's skills to the highest level. So we want to ensure that we have everyone being able to do skills that they're definitely required for. But for the specifics of that, let's direct that to Shared Health or the region.
Thank you. I have no further questions.
From CJOB, Skylar.
Hi, Dr. Roussin. Thanks for your time. You mentioned that social gatherings are quite a large indicator of, where the virus is spreading right now. Obviously, most or all social gatherings with members outside of your household are illegal in Manitoba right now. Are people being forthcoming with contact tracers about these gatherings, when they end up contracting COVID-19, or is that, still somewhat of a struggle like you alluded to a couple of weeks ago?
So we do have that, we do have that issue. I think we see, still cases, and during the contact investigation, that's it's disclosed that the orders probably weren't followed fully, or and then we do find some cases that are not as forthcoming with with their contacts and things. So again, when we speak about these things, again, the vaccine status, someone in ICU or people acquiring it at things that could have been avoided if they followed the orders. Again, this is our risk communication to Manitobans, right? It's not intended to be blaming anyone. So the fact is that our ICUs are full, but they're not full with vaccinated Manitobans. Right. So again, it's not blaming people for not getting vaccinated. There's people who we know were admitted to ICU who were unvaccinated, who actually had appointments to be vaccinated. They just fell ill before that appointment. So it's not about blame, but it's that risk communication. That vaccine is making a big difference right now. When we talk about people acquiring it at gatherings, again, it's not blaming the people that acquired it. It's a risk communication to Manitobans that even though you're there and no one intends to be causing a cluster, we've seen clusters between loved ones who want to gather, who miss each other, but it's had a significant outcome. So again, it's not about the blame, it's about the risk communication. So, and again, with the contact tracing, because of the orders, when people find themselves in violation of the orders, they may be reluctant to be really forthcoming when they're with the contact tracers. We tell everyone, we're only interested in trying to find the contacts. We're not going to be fining anyone for being forthcoming to our contact tracers. We just need to find people to try to get them isolated, to inform that they may be in contact. So we'd really appreciate people's being forthcoming, and again, most people are doing their part.
Thank you for that. And, with Ontario moving to step one of their reopening plan and Alberta making some inroads as well with theirs, it seems, we're kind of late to this party. And, of course, it's beautiful and warm outside, and Manitobans really still don't have much of a roadmap. Is the province ready to provide some light at the end of the tunnel whenever that may come, but at least a path forward with, regard to reopening?
Yeah, I don't have necessarily the specific time frame on that, but we're working on our roadmap to recovery, to a post-pandemic Manitoba. And remember, a post-pandemic Manitoba isn't a post-COVID Manitoba. We're going to be dealing with COVID for likely years to come, but we are going to be in a post-pandemic Manitoba, at some point, and hopefully not too far away from now. So yeah, so we're going to try to communicate what that could look like. Remember, we were late to the third wave, so we're going to be a bit later than other jurisdictions coming out of that third wave. But with Manitobans' work on the vaccine and following these orders, I think we will be coming out of our third wave and starting to see some of that hope in the near future.
From the Winnipeg Sun, Scott.
Hi, good afternoon. Dr. Roussin, you've sort of hinted at perhaps a little bit of outdoor changes. I mean, for Manitobans who have to now wait, still a whole week, and can you let them know that they'll at least be able to meet with somebody outside of their household, when come Saturday, I suppose?
We're not going to have to wait a week to find out, but we don't, disclose, especially since things aren't finalized yet. So I do think that Manitobans have been, great, been very patient, have been working through these really difficult 15 months, and we're not through it. We're certainly not through it coming this Saturday, but I just don't have any specifics to share today. But later this week we're going to have some clarity on that.
All right, thanks for that. It's roughly 70%, and we're getting up there, 70% vaccination first doses. I mean, Manitobans have kind of done what they've been asked to do in that. I mean, 70% was the initial target early on. I guess when are Manitobans going to start to see, I guess, some sort of benefits of getting to that 70% mark in terms of first doses? That's sort of the question. I mean, we've kind of gotten to that point. When are we going to see some sort of benefit from that in terms of our restrictions and that sort of thing?
So it looks like we're at least early on in a downtrend of this third wave. We can't let up though right now, or we could see a resurgence. And again, like I said, the vaccinated people are very unlikely to see themselves get into hospital or ICU. And so, the key to that is whatever our vaccine rate is today, that benefit lags 2-3 weeks, right, while that immunity builds up. So I do think that Manitobans have already seen benefits of these vaccines. Our ICU numbers were very high. We had a lot of disease transmission. But for having that relatively high vaccine coverage, we would have been in a very worse situation. We would have seen much more ICU admissions. You could see the ICU admissions and hospital admissions declined compared to the second wave in the older age categories, and that's because the vaccine's been in place for that much longer. We've seen that benefit on cases and mortality in our long-term care facilities because of the vaccine. So we're already seeing that benefit. Moving forward, if we keep getting those doses into arms, if we keep getting second doses into arms, we're going to continue to reap those benefits.
From CBC Radio Canada, Chloe.
Hi, Dr. Roussin. What are your thoughts on the nurses' strike vote this week and the letters signed by dozens of doctors in support of these nurses?
Yeah, so I don't have any specifics I can comment on that. What I could say is, our healthcare providers, including nurses, have been there for Manitobans. They've been working so hard for 15 months, and the docs, the nurses, the healthcare aides, the support staff, all the healthcare providers on the first line have my gratitude. I'm sure they have the gratitude of all Manitobans. So, It's just been such a difficult 15 months and counting, and so I just ensure that I know Manitobans are quite grateful for all of our frontline providers.
Thank you for that. And also, so you see, you said that we see a transmission coming down and we see daily cases stabilized. Could we say that we've reached a peak?
I think it's when we talk about a peak, we always can identify that peak in the past. It's hard to identify the peak at the present. So what we see right now is our case numbers coming down. We see test positivity very gradually coming down. And again, because we've had a number of days with these low numbers, with low testing volumes, it puts a little bit of a gray area in there. But I do think we're very likely on that downtrend of the third wave now.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. People can't gather outside with anyone. Businesses can't have people on their patios. On the weekend, we had thousands of people cheek to jowl pretty much at Grand Beach and several other places. I was in a relatively remote place and saw multi-family groups gathering, jumping up and down off each other's boats and whatnot. Why should people take public health rules seriously when the province won't enforce them in their own provincial parks?
So I think certainly those rules are in effect. The household gathering limit, the distancing and things are certainly in effect in those areas. So as far as enforcement, the bulletin is coming out tomorrow for that. And I think that overall Manitobans have done a great job at following the orders. I think there's always been some Manitobans that may not have followed them all or at all, but as far as enforcement goes, that's being identified in that bulletin tomorrow.
Forgive me, that wasn't my question, but I'm not going to re-ask it because I only have two. I didn't ask. I know there's a bulletin coming on Tuesday, but thank you for that. Data is a lifeblood for public health, as you well know. Today, Statistics Canada revealed excess death data statistics for the first year of the pandemic. There's a black hole for Manitoba, though. We don't have any of those statistics ready past the second week of December, where most other provinces go all the way through March. How is it that in the midst of a pandemic, basic information like death can't get posted?
I did hear about this, and I think that data is coming from Vital Statistics. So we are following up to ensure that that's going to be available for Manitoba.
Our final reporter this afternoon from the Canadian Press, Steve.
Good afternoon, Dr. Roussin. You talked earlier about the benefits, showing the benefits of being vaccinated. Are you recommending to government that certain services, certain events be open to people who are vaccinated but closed to people who are not vaccinated?
So this is a real, big area with a lot of issues in it. So really what the public health view on this is we need as many Manitobans vaccinated as quick as possible and fully vaccinated. If we get as many Manitobans vaccinated, fully vaccinated as soon as possible, then we don't necessarily have to concern ourselves with this type of vaccine passport idea with it. So there's a lot at play with that. Right now, we're focused on the numbers that we have now, bringing them down, focused on getting as many Manitobans vaccinated as possible. As far as the specifics on, how we could utilize or if we wanted to utilize an actual vaccine passport at something in Manitoba, that's, still a bigger issue and no decisions have been made on that.
And just looking at the sort of daily statistical update we get about age group vaccination, as younger age groups became more eligible and we see the percentages going up, Are you encouraged or discouraged, or is it what you pretty much expected when you see the percentage of each age bracket that has at least one dose?
I think that we've seen that vaccine velocity climbing very nicely. I think that's a tribute to all the work of the vaccine task force, a tribute to Manitobans who have rushed out and booked their appointments, watched closely for eligibility criteria, watched closely for their eligibility criteria for their second doses. So we need that vaccine velocity to continue. We also need to ensure we're targeting vaccine. So it's not enough to have a large amount of Manitobans vaccinated. We need to ensure that in higher risk groups that they are getting vaccinated as well. So we have some more targeted approaches that we're working on there. So, I think overall, if we look at those numbers, they are climbing, and they're climbing every day. And with every uptick of that vaccine percentage, we're that much closer to being able to ease some of these restrictions.
Thank you, Doctor. Thanks, everyone. This concludes today's media briefing.